I'm Rick Kaler. Thanks for joining me today. Well, Jamie Orlikoff of Orlikoff and Associates, which is a consulting firm that specializes in healthcare issues, recently said the healthcare bill was primarily about insurance reform and coverage, not healthcare delivery reform. He made these remarks to a gathering of community leaders in Rapid City, South Dakota in December of 2010. Regardless of what the Supreme Court or Congress may do to the current health care law, we can expect to see many changes in how health care will be delivered. Many things happening within Medicare and apart from the health care bill have bipartisan support and agreement. And these items aren't getting a lot of press coverage. At least I haven't seen much written on these areas. So one big area of agreement that in the future medical providers are going to have to contend with is that they're going to be penalized for actions for which they're rewarded now. Orlikoff noted the current healthcare system rewards the wrong areas. The current volume-based system that pays providers for doing more just doesn't make sense. And he gave several examples where hospitals can actually profit from poor treatment, such as food poisoning, staph infections, or readmissions. Now, as callous as it may seem, each of these cases has the patient needing more medical attention, which means that there's a monetary bonus. Orlikoff says we've got to move away from fee-for-service. In the future, healthcare providers will be punished monetarily for such events. Instead of receiving reimbursement for each service, the hospital will receive one fixed bundled payment for a procedure that will include all the pre-op and post-op services. Hospitals won't be reimbursed by Medicare for readmissions at all, and actually will be penalized if their readmissions exceed a certain percentage. The intention is to give hospitals the incentive to get it right the first time. Now, one downside I see to this is in cases where a readmission is unavoidable. Hospitals may have incentive to cut corners so they won't be, because they're not going to be receiving any reimbursement, and so they won't be penalized. Orlikoff says it's the patient's fault will no longer be an accepted excuse. Much of what goes on in healthcare, he says, is blamed on the patient, yet 50% of prescriptions are not filled because the patient doesn't understand why the medication is necessary, and 48% of patients could not tell you what their diagnosis was 15 seconds after leaving their physician's office. He concluded that the new reimbursement methods will require healthcare professionals to find new ways of delivering information and following up. Another area of agreement concerns transparency in cost and quality. Orlikoff emphasized how difficult it is to determine the cost of a procedure. I've had experience with this myself. You can ask, how much will this cost? The response is often, I don't know, but you'll know at the end of the operation. He added, the same is true in trying to find out the quality of care or the success of a procedure. Now, healthcare providers' cost and quality information will soon be released to everyone. It's going to list the average mortality rate and cost for procedures for hospitals. Starting in 2012, the Department of Health and Human Services will track and release hospitals' harm rates, and the hospitals in the bottom 25% will be penalized. In 2015, this tracking will be expanded to physicians who will receive bonuses for high-quality care and be penalized for low-quality care. There's also broad agreement to move toward evidence-based care, meaning if there's no scientific evidence a medication or a procedure works, Medicare will not pay. Orlikoff asserted that 50% of what we do in healthcare is not based in science. Clearly, the bill didn't address all of the concerns over health care reform. Whether the law is amended, repealed, or kept intact, the debate over health care is only just beginning. Thanks for listening.